Hello, I'm Dr. Mike. I'd like to welcome you to Health Talk. Today's guests are James and Rhonda Tomasi, authors of the book, What Time Tuesday? So our topic, upper cervical specific chiropractic, is kind of a mouthful even to say. What is it, James?
Well, being a patient of it and a recipient of the help that is done through upper cervical, I liken it to the mouth of God, is what they call it outside this country. Upper cervical, of course, is those top two bones at the top of your neck, and they're, excellent. They are the ones that balance this 10, 12-pound bowling ball on top of this broomstick, and heck of a job. Problem is, though, as you well know, doctor, if that gets a little out of alignment, then disease or bad health begins.
Disease.
Disease.
Disease,
good. That's
right.
good, yes.
This is a model of the occiput. This right here is the base of the skull. The top bone, atlas, this model is about twice the size of what these bones really are. This bone only weighs maybe about 4 ounces or so. And it's called atlas because on two little articulations it holds up the skull. And that's the S bone. It rocks. Matter of fact, that's where the term off your rocker came from, when that bone gets out of place. The next one down, C2, the second cervical, is axis. And it has this thing sticking up here, the dens, and that's the no bone. That's how it goes like that. So for that mobility, it gives up stability, and that little opening that you see there can get blocked. And the brainstem sticks right down in here and meets the spinal cord. And so it blocks the communication to the rest of the body. So you had a condition called trigeminal neuralgia. What is trigeminal neuralgia?
Well, it's the facial pain. They say, that pronoun being the medical circles, say that it's the worst pain known to man. There is no worse.
What would you compare it to?
I would compare it to an electrical storm going off in my face and head. It's pain like I know came out of the depths of hell. It's just absolutely the worst feeling pain known to man.
How long did you put up with this?
Well, off and on. It's trigeminal neuralgia comes and goes.
Okay.
So it came and gone for 10 years. And then the last 2 years, Doc, it came and never went away.
2 years?
Yes, yes.
So how did you deal with all of this, Rhonda?
As a spouse, I didn't deal very well with it. I spent hours searching for alternatives. We had the oral surgeon who sliced both of his gums and thought, well, there's an infection there. So he dealt not only with the TN pain, but the suture pain after that. His only relief was the Novocaine, and that lasted 4 hours. And then we had the neurosurgeons who couldn't help. We had the medical doctors. I mean, the neurosurgeons did help. They gave him medication that made him dopey, but it couldn't take the pain away. And then we had the medical doctors who I would take him in and they'd say, pull me to the side, you know, he's just wanting drugs.
Oh, okay.
Sure, I can look in his eyes, and every spouse or family member knows when the TN patient is in pain because there's no communication. There's just this intense pain in their eyes and their features and everything they do. And then we had the Chinese medical doctor, and he could actually move the pain. James can describe what it felt like when it was in his eye or on his tongue, but he could move it back into his jaw area, but he couldn't relieve it either.
Well, I'm curious, how did it start? I mean, what brought it on?
Well, it's amazing. I went to a dentist. And I had some root canal work done. And
so your mouth was like propped way open for a long period of time?
For a very long, about 6.5 hours.
Oh, wow, that is a long time.
And by the time I left, I was feeling no pain, but had a prescription for pain if it happened to come. And as that Novocaine began to wear off, that pain began to come, and it was just, I knew I was in trouble. In fact, I called the dentist, a good friend of mine, the dentist, and told him about it. And that was the first question he asked me. He said, did you fill that prescription? I said, no. He says, well, go fill that prescription and then see me in the morning. I'll meet you in the parking lot. So I did. As I left, I looked at the prescription, and I believed it said take 1 pill every 4 hours. By the time I got and filled the prescription, it was hurting so bad, I knew it said take 4 pills every hour. And so very dopily, I went to sleep frightfully. The next morning, met him in the parking lot. The first relief I felt is the moment that he put Novocaine in my mouth again. It dropped down, and I, being a Christian, I thought, wow, I'm healed. You know, it's taken care of. It's over with. I don't have to worry about it. So he did some more work, and as the day wore on, he gave me a couple more shots in my jaw and said, now go on, you're okay. And I took off, went back to work, and worked for a while, and slowly it came off, the drug, the Novocaine, and the pain was even worse than it was before the day. So it was my start of a 12-year battle of just
So 12 years, that's a long time. What are some of the different things that you tried?
Acupuncture. The acupuncture doctor could actually move my pain, worked on my right leg from the knee down, and as he would put different pins in, he could pull it off. When it was on my tongue, it was one of the worst times. The pain on my tongue felt like an electrode that had been plugged into, you know, just a 220 outlet, and just pinned onto the end of my tongue, and then somebody just flipped the switch on, and it would just shake my head. And
wow.
Actually, my tongue would just curl. And I'd bounce, and then it stopped, and it hit again, then it stopped, and it was just dreadful. So when it was on that, Rhonda would call the doctor, and he'd say, bring him in here, and he'd bring me in, get the acupuncture going, and move it up onto this bone, and on that bone, I could handle it a little bit. I tried, like Rhonda said, the Chinese doctor that gave me a tea. I tried chiropractic. I got snapped, crackled, and popped. And see you next Wednesday, and that kind of an attitude. And lots of medical doctors that, bless their hearts, they truly did want to do something, but their hands were tied. After it took 6 years to diagnose me with trigeminal neuralgia, they then told me it was incurable. I could take and have different types of operations. One was a Teflon tube that they could coat over the nerve, but it only had a 20% chance of success, and it cost $40,000.
Would your insurance cover that?
I just didn't like the odds. I didn't care who paid for it, truthfully. I didn't like the odds because some of the drawbacks of that if it didn't work, that I could go blind in that eye. It could stay and not change at all. It could go to both sides. It could cause just all kinds of damage.
That reminds me a little bit about something I specialize in my practice called Meniere's disease.
Ooh, yes.
And people get very, very dizzy to the point of having vertigo, and they might just be walking down the street and fall down and break their arm or something. They get nauseous. They throw up on themselves. They hear noises in their ear, ringing, different sounds and fullness. And, you know, it comes and goes. It's different in different people. But medically, what they're offered, first they'll put a shunt in. They'll drill a little hole behind the ear, and just as often as not, that'll make it worse or do nothing at all. And they might have to be in bed for 2 months afterwards because they're so disoriented and dizzy. If that doesn't work, they do something that, and they'll just say this rather casually, they'll give you an inner ear destruction, which means they virtually drill everything out and throw it in the wastebasket. You know, throw it away, just take it away. Exactly. So your balance might improve, but you're deaf in that ear, and then what happens about half the time is over a period of time, it moves to the other ear.
Yes.
So now what are you going to do?
Yes.
Or they'll do brain surgery where they open up your skull and they just sever the nerve to your ear, and of course they can't put that back. And then it might move to the other side.
It's one of those, there's not a lot of hope with that disease. There's not a lot of hope with trigeminal neuralgia. Everywhere as you turn, everybody's kind of left with I believe or I think or maybe or perhaps, but never an assurance that we can get through this. We can get out of it. And what happens is each of us begin to lose hope, and then our spouses really suffer.
I really noticed the toll taken on a spouse when somebody has this, because I mean, you take your vows about in sickness, but you know, you're really thinking, I'm going to be a nurse.
Yeah.
You know, and that reminds me of someone called Luella Harris.
Yes.
And Luella Harris was a woman whose parents were missionaries, and when they went to Africa, she got a polio vaccination. And by the time that she got to Africa, she came down with polio and lost the use of her legs. So she was in a wheelchair. She got married, and she's not handicapped. I would never use the word handicap. She does whatever she wants to do.
Well, went on to
and
get her
you don't ever think when you're talking to her that you don't think of her as handicapped at all.
No.
Because she's a very productive, successful woman.
Yes.
And she came down with fibromyalgia, which is also in a way related to these things that we're talking about. A syndrome that there's not a blood test for it or anything like that. And she lost the use of her arm, so then she was handicapped, and her husband had to virtually feed her and bathe her and take her to the toilet, you know, until she found out about something. And maybe I'll let you pick up there, because we're getting a little closer to the exciting part of our story today. So I think you heard her on the radio. I
did hear her on the radio. I had gone out one evening, and James had been telling me on and off for the last year that he was going to take his life. He said, I just can't do this anymore. Yes, and I would each time say, God has a plan for your life, you can't do that. And I didn't want to lose my husband that way. And so when I would leave him, which wasn't very often, we had business and I would have to go out and operate the business, and sometimes even in his pain I would make him get in the car and go with me because I didn't trust him at home. So that evening I needed to get groceries. And I said, James, don't do anything stupid while I'm gone. You know.
But as a Christian, now, were you? I have to say, were you afraid that you were going to go to hell if you did that?
Well, the strangest thing about killing myself, it was difficult as a Christian to believe that would even be possible. But the closer you come to believing in that suicide is going to help, it felt like the spirit of suicide began to come over me. And that spirit was so strong, I actually began to feel good. I began to feel like, I can get my life back from this pain. I don't have to depend on the doctors. I don't have to depend on the pills. I don't have to depend on my wife. I can take my life. It stops the pain. I'm out of it. And I even began to hear a voice from God that says, James, come on up here.
Maybe it wasn't from God. Maybe it was from the devil. I don't know.
Well, yeah,
maybe so.
It was absolutely from the evil one.
Because frankly, you were heavily medicated at this time, right?
Yes,
they give some drugs that most people here probably never even heard of. They'll try one thing after another just to see if it helps, won't they?
Anything, because it's like that's they're handicapped too. They only have so much to do with a disease that's incurable. So, well, try this one. And I think I had mentioned to you at a previous time that one of the ladies that worked in the office said, now, I noticed you're taking this pill now. And I said, yes. And she said, I need you to come back in here in about 6 weeks. We need to check your blood. And I said, why? And she says, because that pill will start shutting your liver down. And I thought, wait, one liver shuts my liver down. I'm out of here anyway. It just, every way you turn, doctor, it was just bad news. It was never, other than being with a Christian praying for you, being somewhere where somebody was, and I'd go to a lot of prayer lines and a lot of churches that had the healer in town, and they'd touch you and say, boy, you're healed, and ask God to heal you. And I thought that was wonderful. And sometimes it would work, I thought, because trigeminal neuralgia just stops sometimes, and then it'll start back again. But it was with me, and I knew it was with me. And when I got this spirit of suicide over me, convinced that he was telling me to come home, I thought, no problem. I can get
So you're here today. You traveled a long ways. You look like you're feeling good. What did you hear on the radio that day?
When I got in the car, I normally have it set on one channel, and for some reason it was on another one that was more of a talk show rather than easy listening music, and I didn't listen to talk shows at the time. And I heard a lady's voice, and she was saying, have you had a pain that the doctors have said you just have to learn to live with it? or you have a pain that's put you in a hopeless situation, and you're looking for a way out. And she immediately had my attention because we fit all the criteria she was describing. And from there she went into her frustration for the 18 months she had the fibromyalgia, and then talked about her being in a wheelchair, etc. And I waited. My only problem with the whole program was that she didn't give an 800 number. I was buying. I was sold. I didn't care what it cost. I was going to take James, because we'd exhausted every other means. And so I sat in the car for 30 minutes waiting for an 800 number. I wrote it down, went in and got the groceries, hurried back home and ran upstairs, and I said, James, I know we found the answer. There's another lady that had pain similar to yours, but it was all over, and whatever this chiropractic is that she had helped. And so we're gonna go. And so
that ended up leading to this book called What Time Tuesday. Where did the title come from?
Well, I had decided that at Tuesday at 5 o'clock I was going to complete suicide. The reason for that, our youngest son Ryan was in soccer practice, and on Wednesdays Rhonda would pick him up. They'd go to the practice at 3:30, be home about 6:30, and I figured at 5 o'clock, house is empty, I can do it then. So when she come rushing upstairs on Saturday, and she just talked.
This is the Saturday before the Tuesday.
Before the Tuesday, right?
Cutting it a little close.
Very close, but you know that's kind of the way he works. You know, he does it that way.
11th hour.
The 11th hour. Rhonda come run upstairs, and she was so excited, and she says, "Geez," she said, "that doctor, that upper cervical doctor, called me back, and I can get you in on Tuesday." And the first question came to my mind is, I said, "I've never heard of an upper cervical doctor. What's that?" And she said, "Well, it's a chiropractor." And I went, "Oh, goody." I mean, I'd been through the chiropractors, and I have nothing against them at all. I'd been through them, but I'd been snapped, crackled, and popped, and I had no desire to go again. But because I knew she was going to live with the shame that I was faced with, or that she would be faced with when I killed myself, I said, "Fine. When?" And she said, "Well, I've got an appointment for you for Tuesday." And I thought, well, "What time Tuesday?"
I get it.
And she said 10 a.m. And I thought, 10? I'm going to kill myself at 5. Yeah, I can do 10.
You can squeeze that in.
I can squeeze that in.
And of course, I mean, this wasn't the first time that she came and was excited about some new treatment that might help, I'm sure. No. So by this time, I mean, you had given up. So
I
it was
had totally
just one more thing that
was, yeah. And then, yeah, once you get into that hopelessness and you believe there is no help, then she could have said anything. In reality,
so she got you to go. What happened when you went?
Went to the office. It looked like a brand new office. There was nobody in there. The doctor didn't even have an assistant. But as she come, I noticed that she was down the hall, and I walked in the door, and she come walking towards me, and she's 6'5".
Oh yeah.
Got great big blue eyes. And hair like only a woman can do when they stick their finger in an electric socket, right? And it just is out like this. Got a gorgeous smile, and I believe she was an angel. And I thought, wow. And she come walking up, and she shook my hand and said, "I've never done anything on trigeminal neuralgia before, but," she says, "I understand that the work that we do and the part of the body that we work on has helped." And she says, "I'd love to help you." And I said, "Fine." And she said, "The first thing we ought to do is find out if your head's on straight." I said, "What?" She said, "Do you remember when you were a little boy and your mom said to you when you do something kind of crazy, she'd say, 'You better get your head on straight'?"
The shape of this is that it's kind of wedged to sit on that bone. So when it slips off a little bit on one side or the other, you'll actually get a head tilt.
The head tilt, yes.
And your body doesn't like that because the brainstem won't work right with your head tilted. The eyes and the ears don't work properly. So if you can't stretch it out, what your body will do, the innate intelligence of the body will actually shift the pelvis to make the head more level and it makes one leg appear shorter than the other leg, and we'll demonstrate that later.
Oh, good. I know it becomes almost so noticeable once you understand that. You can actually see a shoulder drop.
Oh, yeah. I mean, you go walking down the mall, and you're looking around, and you see somebody, and you're like, oh, my gosh, why don't they get that fixed? What they must be putting up with that.
Yes.
Well, I believe that when we were designed and put together, we were balanced. And when it's so obvious to see when you're not in balance now, but I had no thought
It's so
about
important.
that.
People just don't realize that over a long period of time, I mean, like with kids, they'll take a fall and it'll knock that bone out. They'll take another fall, it'll go back in. So for a short period of time, it's not bad. But if it gets knocked out so badly that you can't put it back yourself, and it's that way for years, it'll lead to one problem after another. So where a lot of these people that I treat, they get diagnosed as hypochondriacs because they go in with this shopping list, starting from the top down, like, I get headaches, I get earaches, I get sore throat, so, my vision's cloudy, I hear noises in my ear, my right hand goes numb, my left leg hurts, my left foot hurts, and they go to the doctor, and after a while, he just quits writing this stuff down and goes, oh, brother,
One of the interesting things about James is initially when he was ill, there was a knot larger than my hand on the back of his neck, right in this area. And we just thought I would try to massage it, and because he was in pain, he'd say, don't touch me, don't touch my skin or anything. But after we went through the upper cervical procedure and began to learn more about it, we traced back, and he had had a car accident 30 years prior.
Story, yep, 30 years. It usually takes at least 15 for symptoms to come on, so people don't even tell the doctor.
No.
And they got whiplash, and they don't even know it.
Don't even know it, yes.
So, at what point did you think this was going to help? I mean, what did she do exactly?
She first said she needed to take some x-ray to see where the head was. And so she did, and then after she finished, she had me come in and look at it, and she was right. My head was off on a tilt, and it was a little forward. And she said, your backbone is trying to balance your head, and that's why it's starting to hump a little bit back there. It's trying to get up underneath the skull. And it made no sense to me, and what does that got to do with this facial pain that's going on? She said, now what we're going to do is, she said, I'm going to bring you in here, and I'm going to correct these two bones, and I'm going to get this head back on straight, and then you're going to go home and let your body heal itself. And I thought, you got to be kidding. I'm looking for something that is, I don't know what it is, but I want something.
More drastic.
Drastic. I mean,
instantaneous.
Must be something that I can take, or a bottle of something I can take. Something, but don't say my body's going to heal itself. I've been living with this body.
But what else does? I mean, that's the only, I mean, the power that made the body heals the body, and there are no exceptions to that rule.
There are none. No. Provided, though, that everything is equal. The body can't
take away the interference, in other words.
That's right. And thank God for doctors like you, because you have the ability to be able to look and see and understand how to correct that and allow that bone and that head to get back on straight and let it do what it was supposed to do to begin with.
What I find with people that have these severe problems, and this treatment is good for people with smaller problems too, and it's important that people realize that, not just these really dramatic ones. But when you get in a car accident, your head goes back and then it's thrown violently forward, which makes this bone posterior, and then it's pushing on the spinal cord and brainstem, and an irritation, and it just gets slowly worse and worse. And that's actually the beginning of when you see someone that's elderly and they're bent over looking at their feet, which to me it's the saddest thing in the world, but that's the head is just, and this takes years and years and years, but it just keeps going farther and farther. And if you don't get that subluxation corrected, get it adjusted specifically, it'll never stop. It'll continue to slowly go further and further, and you get bent over farther and farther and farther.
Well, this head weighs, and it's
like a bowling ball, right? Like you said before. So she did the adjustment. You didn't think that it did very much.
Didn't do
so
anything.
how did you change your mind about the suicide thing?
Well, when it was all over with, got out in the car and got Rhonda. First question I asked her was, did you pay her? And she said yes. And I thought to myself, she must know how dangerous I am, because good thing she got her money now, because I'm not going to be here to give it to her. Then I looked at Rhonda and I said, what a ripoff.
Rip-off.
Well,
Yes.
she had adjusted me, showed me that my head was pretty much back on straight again, but my pain was actually worse. It wasn't better. And the trauma of taking me out of that bedroom that I'd been in for 2 years, out in the sunlight and out moving and coming back, was just more than I could handle.
Additionally, a word retracing that you probably heard that most people wouldn't have is a lot of times, even when that bone gets put back more closely to where it belongs, some people, and it's great when they do, instantly get better, and that's great, but a lot of people have to kind of go backwards through all of those problems. It actually gets a little worse before it gets better. Of course, people don't want to hear that. I never like telling people that story. but
Yeah,
continue.
well, obviously that's what was going on with me. I mean, it was back now where it could start to do some work, but I didn't feel it. I just felt the greater amount of pain. Got home, went upstairs, took my clothes off, laid on the bed, and just watched. We had a little clock radio off to the side, and those numbers would flip. And I'm looking for 500. And as soon as that happens, I'm shooting myself. I am out of here. It is so bad, and I'm just at wit's end. But about an hour and a half in laying on that bed, I got about a 10, 12-second break in pain. Just stopped.
You never even got seconds of relief during this time?
No, nothing. Just boom. 10 seconds, 12 seconds. I screamed at Rhonda, and she come running up the stairs. And by the time she got in the bedroom, it was back, and it was back with a vengeance. It was even worse, if that's possible. So I thought it was just me wishful thinking that this would go away and it would be finished. So I was terrible, and I just kind of hollered at Rhonda, just get away from me. It's okay. Bye, just go. And about another hour went by, and this time I got about 20, 25 seconds of no pain. And I knew instantly that that woman doctor had a power over this beast that was killing me. That some way, somehow, God had put, he says it in his word, lay hands on them and they will get well. And that's exactly what she did. She had laid hands on me, opened something up, and it broke the power of that pain. She didn't give me a drug, and she didn't say she wanted to do some surgery. None of that. She simply wanted to get me back the way we had been originally designed.
That's actually what chiropractic means, is done by hand.
Done by, well, because we've since studied that over the years. D.D. Palmer is the man who started the whole thing. It was
and his son, B.J., that started Upper Cervical Specific in the 1930s.
Yes.
That's right. His preacher is the one that gave him the name chiropractor.
That's right.
Yes.
Chiro.
Just
That's right.
It is. This was designed definitely, in our opinion.
And the first chiropractic patient was actually deaf and got his hearing back.
Yes.
And most people think it's just about backaches and stuff like that.
No.
Which it helps that too. And everybody has a backache. It's great to help them, but you know, people forget the history of it all,
further.
which is just fascinating.
Well, as you can imagine, I'm back alive now. I'm so excited about this doctor, I can't believe it. I want to help this doctor in any way I can. I'm speaking at our church. I'm telling them what's going on. And out of this congregation and other friends that we had, in the first year we brought in 350 people that could see how this was really the way it was designed to be.
With all sorts of different afflictions?
From migraine headaches that were so severe they could not get out of bed when they came on, and their husbands would inoculate them to keep them out for 4 or 5 days while this was on so bad. To, well, Rhonda wrote a list in here you're not going to believe.
No, really?
Well, you're going to believe.
And what kind of a success rate did these people have? I mean, was quite a few of them get help? Or?
Well, let's say it this way. After 2 years...
This is a trick question because I know the answer.
Listen, it's difficult for... Yeah, go ahead.
After 2 years, the receptionist called James. We would go in for maintenance. I mean, you do follow-up care.
Right, need a little maintenance, like going to the dentist, for
because
instance.
That spine
You don't
doesn't
just go
change
once.
overnight. There's a process for it to realign correctly, you know. And so the receptionist said, James, we have a game in our office. We track back to which patient you told this person to this person to how they came back to James. And anyway, she said, we're up to 1,500. So if it didn't work, those 350 would not have multiplied
Yeah, if it
themselves
doesn't
and
work,
told
people don't keep going.
They don't
You're
keep
right.
going. We have one case that I thought was so interesting. This was a lady and a husband in a church. They had 2 children that you call normal. But they had one child that was now 9 years old. The doctors had recommended operations over and over. He was in a fetal position, diagnosed with MS.
Yeah.
They brought him to church in a baby carriage that was oversized, one of those old-fashioned ones. And I talked with Anita a year after she began to bring him in for under upper cervical care because they didn't want to do the operations that had been recommended. And I said, what changes have you seen? And she said, I just wrote Dr. Jennifer a 3-page letter on all the changes, but briefly, before he was like a vegetable. He couldn't communicate at all. Now he has hand mobility. I can lay him in front of the window, and he couldn't see more than 3 feet previously. Now he can watch his siblings play in the yard. He interacts with them on a one-to-one basis. We don't know that he'll ever be completely normal, but the changes, he can hold his bladder and his bowels now.
Hold his bottle?
And yes, and he was progressing to be able to hold a sipper cup hand